Prevalence and impact of psychological problems on healthcare workers and occupational therapists. My name is Elizabeth Brand. I'm a second-year OT student at the U of A. What is psychological health? Psychological health comprises our ability to think, feel, and behave in a manner that enables us to perform effectively in our work environments, our personal lives, and in society at large. How prevalent are psychological health problems within healthcare practitioners and OTs? Before we can address this question, it is important to consider the prevalence of mental health issues on a global scale. When looking at the general population, we can't assume these issues exclude healthcare practitioners or OTs. 1 in 4 people in the world will be affected by mental or neurological disorders at some point in their lives. Around 450 million people currently suffer from such conditions, placing mental health disorders among the leading causes of ill health and disability worldwide. Additionally, mental health and behavioral disorders account for 12% of diseases worldwide, taken from the World Health Organization. This is a bit of background to help set the stage that individuals coming into the workplace may and do experience pre-existing mental health issues. Prevalence of psychological health problems in healthcare workers. According to Statistics Canada, healthcare providers are more likely to experience stress in the workplace compared to other non-health related jobs. In 2003, it was measured that 45% of healthcare workers reported feelings of high and extreme stress compared to 31% of all other employed people. This information highlights the psychological risks and predispositions such as stress, fatigue, emotional exhaustion, and other challenges due to the nature and demands of the healthcare occupation. In one study looking at cancer care workers in Ontario and evaluating the prevalence of burnout, job stress, and job satisfaction, participants were classified as physicians, allied health professionals, and support staff, all working within the field of oncology. The result were that rates of emotional exhaustion were higher in physicians, followed by allied health professionals, and finally support staff. This research suggests a higher risk of psychological health complications and symptoms for those in direct and frequent contact compared to those involved, but not to the same extent. This may be generalizable to any healthcare occupation in contact with sick individuals. Psychological health issue prevalence within occupational therapy. Not applicable, right? I hope you just laughed at this ridiculous statement, because according to Gupta, laughter is associated with low emotional exhaustion and is inversely related to burnout. In various studies, it is shown that OTs experience emotional exhaustion, cynicism, and feelings of low personal accomplishment. In one particular study looking just at psychological health within occupational therapists, it was found that about 14% of highly engaged OTs were also in the top third for burnout. This article highlights that decreased work engagement leads to increased burnout and vice versa. Most stressed healthcare occupations, you can see there OT ranks number 9. This was in a 2007 analysis of Stats Canada Canadian Community Health Survey and ranking health professionals for most stressed occupations. This same study reported that 47 of occupational therapists found most days of work quite stressful to extremely stressful. So a poor psychological work environment has a very downstream effect, affecting the employees, in our case the occupational therapists, which then affects their work output and their interaction with coworkers and clients, and thus is community impacting and organization impacting, and is a very strong process, and thus highlighting the importance of getting it right in the workplace and how beneficial that is to everyone. Right, so health and safety risks of unaddressed OT workplace psychological health problems. This is defined by existing evidence. Decreased engagement, increased burnout, increased emotional exhaustion, depersonalization, high absenteeism, low employee commitment, and a higher work turnover. Also, professional resilience. Professional resilience can be seen as both a psychological benefit and a negative. When looking at the last point, what I want to stress here is that within the study, mental health OTs were struggling with professional identity and validation of occupation, focused practice, thus becoming more resilient. the health and safety risks of unaddressed OT workplace psychological health problems. So these are what I came up with basically. And I'm sure there's many more. Higher chance of making mistakes due to longer shifts, negative impacts on OT treatment and the outcome of OT treatment as a result of less involvement, enjoyment, and commitment to the profession and the client, sending individuals back into community when they are not ready nor equipped with proper coping and functioning skills, negative relationships with coworkers due to lack of role clarity amongst healthcare professions, impact on home, private life, work stressors carry home from work, economic impact of increased funding spent on mental health disability claims and loss of productivity due to time off work, substance use, and abuse. Right, so what can we do? Time for a change. Fortunately, with the rising prevalence of mental health issues globally, the seriousness and effects are becoming more renowned and thus being more thoughtfully considered and managed. Insurance companies taking action, increased legislation, Mental Health Commission of Canada. So there's some tips for your reference, additional resources, and my references. Thanks for listening.